Hello. In this video, we are going to talk about skin problems in diabetes. Why are we doing skin problems in diabetes? Sometimes skin problems may be the first sign of diabetes. Sometimes it can give you a clue of impending damage. So, there are very many reasons why we need to pay attention to our skin in regards to diabetes. Why does diabetes affect the skin? The high blood sugar over time damages blood vessels, nerves, and weakens the immune system. 30 to 70% of the people with the diabetes develop skin issues at some point. Skin changes can sometimes be the first sign of diabetes. Things like dark patches in body folds. Let's dive into skin conditions linked to diabetes. The first one is dark velvety skin, otherwise called Acanthosis Nigricans. A dark patch or band of velvety skin on your neck, armpit, groin, or elsewhere could be a sign of prediabetes. The medical name for this condition, as I mentioned earlier, Acanthosis nigricans. Why does it happen? Because of insulin resistance. So presence of dark velvety skin indicates there is an insulin resistance. So what do we need to do? Get checked for diabetes or prediabetes. Second is brown spots on shins. The medical terminology is called diabetic dermopathy. When this condition begins, you usually see round or oval spots which often develop on the shins. That means the front of the lower legs. The spots may be brown or reddish brown in color. Early on, these spots often feel scaly. As they flatten out, they can cause small dents in the skin. Unlike age spots, these spots often start to fade after diabetes is well controlled, usually within 18 to 24 months. Diabetic dermopathy can also stay on the skin indefinitely. While these spots are harmless, anyone who develops them hasn't been diagnosed with diabetes should be tested. So, presence of diabetic dermopathy or spots over the shins will warrant the testing for diabetes. If you have a diabetes, tell your doctor about these spots. Some people who have diabetes and shin spots have a higher risk of developing complications like neuropathy, which is nerve damage that can lead to weakness, numbness, and pain. The reason for these spots possibly minor injuries or because of decreased blood flow. The third skin manifestation is shiny, waxy patches, otherwise called Necrobiosis Lipoidica. When this condition begins, you will often see one or few reddish brown spots on your shins if you have lighter skin tone. People with the darker skin color often see purplish spots. These spots ain't itchy or painful. The medical name for this condition, as I mentioned earlier, necrobiosis lipoidica. These spots grow slowly, becoming one or more patches that may be yellow, reddish, brown, or purplish. In the center, you may see waxy skin that is thinning blood vessels or both. The fourth, hard, thickening skin. If you have diabetes, hard, thick, and swollen looking skin can develop even when diabetes is well controlled. The medical term for this condition is called Scleredema diabeticorum. It often develops on the upper back. The skin thickens and tightens slowly over months or years. This condition can also occur on the shoulders, neck, or elsewhere, but never on the hands or feet. Next is skin tags. Many people have skin tags, which are harmless growths that can appear anywhere on the skin. Sometimes skin tags are firmly fixed to the skin. You may also see the ones that dangle from the stalk. The medical name for this growth is called acrocordons. While skin tags can develop anywhere on the skin, they are most common on the eyelids, neck, armpit, and groin. Diabetic skin also prone to develop infections and other infective rashes. Why? The high sugar weakens the body's ability to fight infections. Diabetes weakens your immune system, which reduces your body's ability to fight off harmful germs and increases the risk of developing infections. It's common to develop infections in mouth like oral thrush or in vagina like yeast infection. So, the fungal infections like ringworm, bacteria, thrush, intertrigo, those are all common in diabetic patients. Bacteria also can infect, most commonly caused by staph. It can cause cellulitis. It heals slower due to poor circulation. In addition, they have been immunocompromised. There's another lesion called Granuloma annulare. What is Granuloma annulare? It's a cluster of small bumps or raised patch. It's often ring-shaped rash, possibly linked to diabetes. Whether this skin condition is associated with the diabetes is controversial. We know that most people who have granuloma annulare do not have diabetes. But people who have granuloma annulare that comes and goes should be tested for diabetes. Next is diabetic foot sores. It happens because of nerve damage and also for because of poor blood flow. Having high blood sugar for a long time can lead to poor circulation and nerve damage. You may have developed these if you have had uncontrolled or poorly controlled diabetes for a long time. Poor circulation and nerve damage can make it harder for your body to heal wounds. This is especially true on the feet. The open wounds are called diabetic ulcers. The diabetic ulcers can lead to infections. Sometimes it will lead to amputations if it is not identified and treated aggressively. How to prevent it? Check your feet daily if you are diabetic. Wear proper shoes. Keep skin moisturized. Next is sudden yellow bumps, otherwise called eruptive xanthomatosis. Uncontrolled diabetes can cause extremely high levels of triglycerides, a type of fat that circulates in the blood. If this happens, you can develop a skin condition called eruptive xanthomatosis. These are all small, firm, yellow bumps, often seen on legs and buttocks. After the bumps appear, they soon develop a yellowish color in lighter skin colored patients. If you have a darker skin color, you may see a grayish color with yellowish hue beneath. You'll usually find these bumps on the buttocks, thighs, crooks of the elbows, or knees. They can form anywhere though. No matter where they form, they are usually tender and itchy. Once the diabetes is well controlled, the bumps tend to go away. How to treat? Control the diabetes. Sometimes these patients need cholesterol lowering medicine. The next one is diabetic blisters. The medical term is bullosis diabeticorum. Look like painless blisters on the hands and feet. The good news usually heal on their own in weeks, but it indicates there is underlying prediabetes or diabetes need to be tested and to be treated aggressively. Next one is calciphylaxis. It is the most dangerous. It looks like painful deep ulcers with the blackened skin. It requires immediate medical care. The next one is yellowish smooth bumps or patches on and around your eyelids. These bumps and patches develops when you have high levels of fat in your blood, which can be a sign that you have poorly controlled diabetes. The medical name for this condition is called xanthelasma. Regardless of your skin color, these bumps and patches look yellowish or yellowish orange in color. It's most commonly associated with the diabetes. Sometimes it can be associated with conditions such as hypercholesterolemia. It is a genetic disorder where the fat content of the blood is higher. Next, how to protect your skin. The first and foremost, control your blood sugar. Keep the hemoglobin A1C normal. Keep your skin moisturized. Use urea based creams to help dry skin. Keep skin clean and dry. Avoid hot water and long showers. Implement seasonal skincare changes to prevent dry skin when the temperature drops by using a humidifier to replenish indoor moisture levels within heated indoor air. Treat cuts right away. Use sun protection daily, meaning use sunscreens with a sun protection factor SPF of 35 or higher on all areas of exposed skin. Choose sun protective clothing and avoid unnecessary exposure to UV rays. Wear 100% cotton underwear. Check your feet daily for cuts, blisters, or redness. Treat infections early using antifungal creams, antibiotics if needed. Avoid walking barefoot to prevent unnoticed injuries. When to see a doctor. When you find new rashes, slow healing sores, or painful skin changes, immediately seek medical care. Or when there is signs of infection, such as redness, swelling, or pus. In patients with diabetes, the signs may be subtle. Even small changes should prompt you to seek medical care. The key takeaways from this video: diabetes can cause many skin changes, from harmless spots to serious infections. Good blood sugar control with daily skin checks can prevent most problems. Food care is very critical. Small cuts can become big problems if ignored. Thank you for watching. This is most important topic. Please share this video with others. It will help them to identify diabetes early on and also address it very early on to prevent catastrophic consequences. Thank you so much again.